everybody, this is Dr. Langdon, board certified pediatrician, mom of 6, grandmother to 3, with a brief return to a topic, nosebleeds. It's been requested. I had done one a long time ago. Most of the information is the same, and that is your nose is prone to bleeding because it is so well vascularized. That is, there are so many blood vessels in there on purpose so that it can warm and humidify the air as you breathe. You can imagine when it's very cold like it is now, the air is drier, and as you breathe, that air can dry out the lining of your nose. Well, imagine, if you will, all these big, juicy blood vessels, even juicier if you have a cold, a viral upper respiratory infection. If you have allergies, allergic rhinitis, all these juicy blood vessels sitting right there with this thin saran wrap, sort of even thinner than that, layer on top of those juicy blood vessels. Well, if you get a tiny crack in that layer, juicy blood vessels, nosebleed, right? So anything you can do to not dry out and crack that lining is going to help prevent nosebleeds. So you could run the cool mist humidifier. You could apply a thin layer of Vaseline or Aquaphor inside there. We don't recommend Neosporin anymore. And remember, when you're applying that Vaseline or Aquaphor, it's that middle wall, the nasal septum right there. That's where all the blood vessels are. It's not usually on the outside edges. It's that middle wall. So apply the Vaseline gently on that middle wall. Also, avoid what we affectionately refer to as digital trauma. That's a big cause of nosebleeds because you could accidentally cause that crack in the wall, in the lining, right? The edge of your fingernail if you're picking your nose. Now, everybody's going to pick their nose. I'm not saying that's a sin or wrong, but please be careful because if you scratch that lining, it's going to bleed like crazy, right? Now, once you've had a big nosebleed, you're very prone to having additional smaller echoes afterwards because your body's created a clot over that nosebleed. That reminds me to tell you, if your nosebleeds are in the picture of unexplained bruises, gum bleeds, blood in your urine or stool, a little rash called petechiae, which are tiny little red dots that don't go away when you push on them, that's different, and you need to see your doctor urgently. You could have a clotting problem or low platelets. I'm talking about the classic, extremely common nosebleeds that kids and adults can have. Let's talk about what to do when it actually happens. When you do have a nosebleed, you need to pinch and hold. Most folks like to pinch and check. That doesn't work. Pinch and hold. You can use a washcloth over that or a handkerchief. If it's still bleeding, do an ice pack on there to shrink those blood vessels. Let's talk about shrinking blood vessels. There is a medicine called Afrin, an over-the-counter nasal spray that is, its mechanism is to shrink the blood vessels. So we will very sparingly, with great caution, say you may use the Afrin for severe recurring nosebleeds, but for no more than 2 days. Afrin does this crazy thing where it tells your body, shrink blood vessels, but then if you use it a long time, when you quit using it, the blood vessels are extra congested because nobody's telling them to shrink, and they're not used to being told to shrink. So do not ever use Afrin for more than 2 days would be my recommendation. So all the tricks, if you're having recurring nosebleeds, elevate your head, take the pressure off, run the cool mist humidifier, moisturize the air, Vaseline to moisturize the lining to help prevent it from cracking. When it happens, pinch and hold. Do not tilt your head back. That just makes the blood go down your throat. You swallow it, goes to the tummy, and especially in babies and kids, that swallowed blood is very irritating to the stomach, and so then you may have a child who's vomiting blood, which is even more disconcerting than when you have a child with a nosebleed. So pinch and hold, moisturize. You got this, guys, and it's very common and not a cause for major concern unless it's lasting for more than 15 minutes. And then your primary care provider or pediatrician may refer you to an ear, nose, or throat doctor who can do some cautery in there to help with the recurring, severe, long-lasting nosebleeds. I hope that was helpful, and thanks for the request for this topic.